Tonight, the alarm bells are at their loudest. Kenya is in the grip of an ugly upsurge of the coronavirus pandemic. The Ministry of Health tonight reporting the month of October as Kenya's worst ever since the first case of COVID-19 was reported in the country in March this year. And tonight, the number of infections for the month of October alone stand at a whopping 14,000 cases, with over 250 deaths within October alone. Health Cabinet Secretary Mutahi Kagwe says the second wave, which has started in earnest, could make or break the country's battle against the virus, with most Kenyans having dropped their guard. Sam Gituku starts off that report tonight.
When Kenya lifted most of the restrictions at the end of September, it was in the basis that the country had started to flatten the COVID-19 curve, reporting a positivity rate of less than 5% on several days, albeit not consecutively. It was a celebration of what appeared to triumph over the disease when top government officials congregated at the KICC to celebrate a job well done. But not so fast.
We are essentially in some sort of second wave of the virus infections in our country. On the first wave, the highest point, the highest positivity rate, round about July, was about 13% positivity rate. The day before yesterday, we had a positivity rate of 20.2%. Yesterday, we were at 15%. Today, we are once again at 15%.
Out of the 29 days of October, all but 2 days have reported a positivity rate of more than 5%, even recording at 20% on Tuesday this week. In the latest figures, the positivity rate is at 15% after Kenya reported 761 new infections from a sample size of 4,830. On the same day, 14 people died, bringing the total for the 4 days of the week to 54, likely to surpass every other record of weekly deaths. In the month of October, 14,083 new infections have been recorded, a daily average of 485, higher than daily average of all previous months. July, which earlier recorded a spike, later interpreted as the first peak, had 14,270 infections, a record likely to be surpassed in October. While a total of 964 have so far lost their lives to COVID-19 complications, October has the highest fatality rate, now standing at 253. Over the past 1 week, an average of 13 deaths per day have been reported. Since the lifting of restrictions, 264 deaths have been recorded and 14,444 new infections. Over 9,000 of the infections, however, have been recorded in just 5 counties. Nairobi leads with 4,643 infections, followed by Nakuru's 1,448 new infections that have pushed Nakuru's total to more than 2,500 infections. Mombasa follows with 1,316 new infections, Uasin Gishu with 979, while Kisumu has recorded 616 new infections since reopening. Other counties that have experienced double the number of infections since the 20th of September are Kisii and Kilifi. Bungoma's numbers have grown more than 5 times, while Kakameg's infections have grown more than 4 times to stand at 353 infections at the moment. 1,084 persons are in hospital, among them 35 in ICU facilities, 432 in home-based care. Since the pandemic hit the country, over 35,000 have recovered, while most of the 16,000 considered active cases are unaccounted for as they have not been captured as being in hospitals or under home-based care, neither dead. President Kenyatta is set to meet the summit of the county governors next week to review the upsurge of COVID-19 infections and search for means of containing the spread. Sam Gituku, Citizen TV, Nairobi.